Are intolerance of uncertainty and urgency related? Examining the link between intolerance of uncertainty and positive and negative urgency in veterans with comorbid PTSD and substance use disorders. Article by Dr. Adam McGuire and colleagues. Presented by Candace Hayden. This study focuses on two important factors of emotion regulation: intolerance of uncertainty and impulsivity. So let's get a better understanding of these. First, let's begin with impulsivity. Past research has shown us that those with greater levels of emotion dysregulation are more likely to endorse impulsive behaviors as a way to cope with distressing emotional experiences. Impulsivity in response to strong emotions can be broken down into two facets called positive and negative urgency. Positive urgency is the tendency to act impulsively when experiencing extreme positive emotions. Let's say an individual in the military is given a meritorious promotion. This person may experience unusual levels of confidence and may impulsively start making large purchases, spending money they haven't earned yet. On the other hand, negative urgency is a tendency to act impulsively when experiencing extreme negative emotions. An example of this could be a highly impulsive individual with alcohol use disorder is more likely to participate in high-risk drinking in order to cope with intense negative emotions, such as sadness, anger, or shame. Now let's take a look at intolerance of uncertainty. In a nutshell, intolerance of uncertainty is the tendency for a person to experience feelings of discomfort when thinking about future encounters, even if these encounters are not likely to happen. We all experience intolerance of uncertainty to some degree. However, those with high levels of intolerance of uncertainty may experience severe levels of stress and anxiety. For example, let's say an individual in the military is told they may be deployed to an unnamed location at any time in the next 2 weeks. While the uncertainty of not knowing if and when you may be deployed would cause reasonable distress to anyone, those with high levels of emotional regulation may resort to negative behaviors, like drug use, to cope with the discomfort of not knowing. The level of discomfort they may experience from not knowing influences the decisions they make. Ultimately, the decision to engage in certain behaviors provides an immediate reward or reduces the uncertainty in some way. The co-occurrence of post-traumatic stress disorder and substance use disorders are extremely common within the veteran population. When someone is diagnosed with PTSD simultaneously with the substance use disorder, they're more likely to suffer negative consequences, like being unemployed and having less education, and more severe medical and psychiatric illnesses, compared to those with only one diagnosis. Because the consequences of these two co-occurring disorders are so severe and common, it is very important to examine maladaptive emotion regulation strategies within this veteran population. Maladaptive coping strategies are problematic because they can have destructive outcomes like self-harm, aggression, and risky behaviors. And to make matters worse, some of these maladaptive coping strategies tend to strengthen comorbidity. So, for example, veterans with PTSD may use the maladaptive coping strategy of drug use or alcohol use to cope with the symptoms of PTSD. Unfortunately, this often leads to increased and worsening symptoms, as well as possible chemical dependency. So why does this all matter? It's important to understand whether there is a relationship between intolerance of uncertainty and impulsivity in this dual diagnosis population, because these individuals are at a higher risk for engaging in impulsive behavior following strong emotions. They're also at a greater risk for experiencing frequent and severe emotional distress because of PTSD. Therefore, intolerance of uncertainty might be an important correlate of urgency, which demands further investigation. So the overall purpose of this study was to explore whether there was a relationship between trait intolerance of uncertainty and negative and positive urgency in veterans with a dual diagnosis who are seeking treatment for both PTSD and substance use. So in order to test this, researchers recruited treatment-seeking veterans with a dual diagnosis of PTSD and substance use disorder. They filled out self-report surveys measuring their symptoms of PTSD, intolerance of uncertainty, and impulsivity. Each variable was measured using the following self-report measures: the PTSD checklist, the Intolerance of Uncertainty Scale, and the UPPSP Impulsive Behavior Scale. Linear regression analyses were used to test two separate models in which positive urgency and negative urgency were set as dependent variables. In both models, intolerance of uncertainty was added as the independent variable, and PTSD symptom severity was used as a covariate to look at the unique association between intolerance of uncertainty and urgency outcomes. So what did they find out? Researchers found that those who reported high levels of intolerance of uncertainty also reported high levels of positive and negative urgency. This means that a significant relationship has been identified. However, it's important to note that a relationship between the two variables doesn't mean one is predictive of the other. Results from the study indicate that further exploration is needed. Every study has its limitations. There are 3 limitations in the study that could be addressed in future research. First, this was a cross-sectional design, meaning everything was measured at one point in time. Meaning, we can't assume that intolerance of uncertainty predicts positive and negative urgency. However, we can say they are related to each other. So in the future, research would benefit from conducting a study where data is collected more than once at different time points. This would allow researchers to identify whether trait intolerance of uncertainty predicts changes in positive and negative urgency over time. Second, we assume that urgency will lead to risky behaviors like substance use, but this study didn't examine any behavioral outcomes to indicate whether there was self-reported urgency. Future research can address this limitation by directly measuring substance use or other maladaptive coping behaviors that can perpetuate both PTSD and substance use. And finally, a majority of the sample of participants were male veterans, and they were already seeking treatment. So we can't assume the findings would generalize to other veterans who are not male, seeking treatment, or don't have access to treatment. So in future studies, it would be helpful to gather a more diverse sample that would include all genders and not treatment-seeking veterans. So what does this all mean? McGuire and colleagues extended our current understanding by conducting a preliminary examination between the links of intolerance of uncertainty and negative and positive urgency. Their results show that high levels of intolerance of uncertainty was linked to both types of urgency in a dual diagnosis veteran population. In the future, researchers may extend these findings even further by examining how critical of a role intolerance of uncertainty plays in negative and positive urgency for this specific population.